Motivation for our research was a experience that I had with a patient. We had a Spanish-speaking patient that missed 2 MRI appointments, and the reason behind that was that she couldn't understand the reminder message that was provided for her to attend her appointment, and that made us wonder how many other patients are getting lost in the system for missing appointments.
Yeah, right. In radiology, like other medical specialties, we experience a lot of patients not attending the medical appointments for various reasons. We call them no-show, and there was limited literature behind this as to what's causing this. What's the real cause for not a patient being able to show for a medical appointment? We had these questions in mind. That's why we designed this study to kind of answer these questions.
So we focus our efforts on those patients that miss appointments in radiology. Instead of calling them no-show, we prefer to use the term missed care opportunities because that better reflects the provider's responsibility for ensuring that the patient attends an appointment and makes it to provide better health care for them. The reason we focus on obtaining data, demographic data, including language, age, gender, race, ethnicity, religion, among others. And we aggregated data, internal and external sources of data, to have a better understanding of their social genome and how that is impacting their attending radiology appointments.
We collected, like how Efren explained, we collected data of over 1 million patient visits for imaging services to our institution, Mass General Hospital, over a 1-year period from February 2014 to February 2015. And we studied the risk factors associated with no-shows or missing care opportunities. Like Efren explained, we try to use the term missed care opportunity versus no-show because we believe by saying a no-show, we place the responsibility all on the patient, whereas it is actually the mutual responsibility of the provider and the patient at the same time. It is the provider's responsibility to make sure patient has good access to health care when they schedule an appointment. That's what we call missing care opportunity. Actually, for every patient who doesn't show for a medical appointment, we are missing an opportunity to provide care for them. And we have had experience of patients who didn't show up, who didn't show up for a radiology appointment, and that led to loss to follow-up for many days. We had over 86% of patients who lost to follow-up more than 3 months after one single no-show for radiology appointment. So we were trying to, like with designing this study, we're trying to address this question.
So our study showed that socioeconomic disparities do exist in radiology. We've seen that there is a higher likelihood or significant association between African American and Hispanic ethnicities and missed care opportunity. We also seen that based on the Boston City census data, that areas that have higher unemployment and lower median household income have a higher rate of missed care opportunities. For us, this study was an eye-opening moment to say that we need to do something for these patients and address healthcare disparity and provide diverse healthcare.
Okay. I want to add that we showed a high rate of no-show for medical appointment in our institution. Over 500,000 outpatient imaging studies that we did over the 1-year period. More than 8%, we had more than 8% no-shows, which is a relatively high number. And this no-show missing care opportunities was the most common reason for not completing an imaging studies. Among other risk factors that the interesting part was that majority of the patients who no-show for a medical appointment or we miss their care are minorities, like patient with low income, patient with non-English language as a primary language, or patient with transportation issues, with social, like financial issues, all minorities who are per se more vulnerable to poor health care. They are also more vulnerable to poor or poor healthcare access.
The repercussions are that most patients that come to radiology have an acute problem. For example, patients come for a chest radiograph when they have a question of pneumonia. They may get a brain MRI when they have dizziness, or abdominal CT when they have abdominal pain. And by missing an appointment or by having a missed care opportunity, we're delaying their diagnosis for what is probably an urgent issue. And by delaying their diagnosis, we're impacting negatively their health care. So instead of diagnosing, for example, a pneumonia or any other condition that could be treatable as an outpatient, that patient may go undiagnosed for a longer period of time and then present to the emergency room or get admitted to the hospital because of a complicated condition that was never treated on time.
I want to add that, like Efren explained, I can say there are two sides to this. First, from the patient care perspective, it leads to delayed diagnosis and non-optimal patient care for obvious reasons. And from the other hospital perspective, it is associated with huge financial and economic burden to the hospital. We estimated more than 8 million lost Medicare revenue, lost Medicare payment to the hospital because of this no-show in our institution in the calendar year 2014.
So the solution that we propose are that we diversify healthcare delivery and focus our efforts on making sure that patients have fair access to the healthcare that we provide. What we're trying to say is that we want to provide equitable healthcare. Solution, potential solution that we can offer for them would be reminder messages on their own native language, transportation, facilitating transportation access. We want to ensure that patients that have difficulty navigating the system because of cultural or language barriers, we have a better understanding, we can provide an aid for them. And also, what we're trying to suggest here is that it's time for radiology to leverage technology and use it for engaging our patient and making sure that patients have fair access to healthcare and that no patient is left behind.
We also want to introduce a new term, patient connectivity. I want to suggest or work towards establishing a platform for any patient who represents to a healthcare provider or schedule an appointment. We collect certain data and we measure an index that we call this patient connectivity index. And based on that patient connectivity index, we identify patients who are high risk for losing their access to medical care or missing their care or no show for a medical appointment, or more generally missing care opportunities. So we want to introduce that platform and implement this platform ultimately in the patient care to ensure that all patients who represent to the hospital will get equitable care and equitable access to the care that they deserve.